Still trying to crack the code.
Still has nothing conclusive on him.
Keith Grant is the Senior System Director for Infection Prevention at Hartford HealthCare. He's tried one approach after another. For one effort, he surveyed about 1,200 patients, and many responded that lack of transportation was the reason they didn't get vaccinated. So Hartford HealthCare spent $1.4 million to set up a rideshare program. The results were disappointing. So they told you we need transportation, you delivered transportation, and less than 20% took
Less than 20% took us off on it.
Why do you think that is?
And that's one of our biggest challenge. Some individuals, the timing wasn't right. For some individuals, they still didn't really believe in the vaccine or believe in the actual process itself.
Grant says there have been wins, but understanding the losses is critical.
Well, because, losing, unlike many things in business and healthcare, losing is not just the metrics now. It's like people. It's actual people.
Individual people who haven't gotten vaccinated
100%.
and are at risk. Now, Grant is moving well beyond the hospital campus, working closely with those who can influence the black community.
A lot is on my mind about this vaccination.
That includes pastors Michael Bailey and Leroy Bailey III at the First Cathedral, one of the largest black churches in the area, and Brandon McGee, a Democratic state representative. The church is already hosting vaccine clinics like this one. But these men are trying to untangle the many reasons black residents aren't getting vaccinated.
Folks are struggling, and some of the immediate needs like food, shelter, access to just health care in general, that's at top of mind. So when you begin talking about you want me to go get tested, you want me to figure out this vaccine, and I'm reading on the news what's happening, I'm confused. I just need some money for my food.
On the table. Yeah, and I don't got time to get sick because I got to deal with all these other issues. I don't got time.
I think one of the main problems is that people are scared. That's real. How do we get fear out of people? And I think that's an issue, especially in our community.
We didn't hear from you.
Was it the Tuskegee
experiment? Yep.
McGee says his constituents tell him all the time that they distrust the government because of cases like the Tuskegee syphilis study, in which government researchers deliberately withheld treatment for poor black men. But he says this is a different moment.
We were tested on. So I hear you. I hear you. But now we have an opportunity as a community, as leaders, to turn that page and say, look, if you want to be healthy, you want to live, you might want to be vaccinated.
Of course, the black community is not monolithic, and many black Americans have been vaccinated.
I think the first time we had the clinic, it was about 70 people that came out.
Jamaican immigrant Donna Trowers Morrison asked her pastor at North United Methodist Church to urge parishioners to attend a vaccine clinic she organized. It was a huge success. Hartford has a thriving Caribbean immigrant population that Trowers Morrison says has a different history.
As a Caribbean person, we accept it. We accept the system more just because we weren't a part of the history of what happened in the past.
We don't know what's going to come out your mouth.
But tough work remains. At Anthony Williams' barbershop, he's been taking a lot of flack for changing his mind about the vaccine.
Look, now I'm a sellout. This is crazy.
You are a sellout.
I am not a sellout, bro. I had to.
This man, Taj Gibson, says there's nothing Williams can say or do to convince him until the vaccine has been out longer. What would it be for you, though, if you had to put a number on it? Would it be after a year, after 2 years? Do you want to see 10 years?
3 to 5 years. 3 to 5 years.
And so what do you make of the millions and millions and millions of people that have gotten the vaccine and have been okay?
Everybody's different. Everybody's individual body is different.
16 years, I've been working so much.
It's been quite a journey for Williams. He's had a change of heart, not only about the vaccine's safety, but also what he now sees as his responsibility to convince others. He's working on them, one at a time. For the PBS NewsHour and Kaiser Health News, I'm Sarah Varney in Hartford.